2 people have died and scores injured in a lightning strike in Mathibestad in the northwest. The provincial health department says 150 people were struck by lightning and 13 of them in a critical condition. The majority of those patients sustained mild burn wounds and a number of them were treated and discharged. Now, tragedy struck when the group was attending an event at the Dirtik sports ground. Residents have been advised to remain cautious as adverse weather conditions persist across the country. Let's continue to get more details on this incident and some of those who are still receiving medical attention. The Northwest Department of Health spokesperson Tshegofatso Mothibedi joins us for more. Tshegofatso, thank you so much for joining us and welcome.
Thank you very much. Compliments, Nompu, and good morning to your viewers.
Tshegofatso, let's start with those who were in a critical condition, who have been taken to Jubilee Hospital. Just let us know what their status is so far.
Well, the 13 critically ill patients who were transferred to the Jubilee Hospital were there for management of various injuries. Some of them, or most of them actually, were as a result of being struck by lightning. We know that at least yesterday, 36 more were seen by our doctors at the Mathibestad Community Healthcare Center. So as is, the situation remains. The 13, we are told that they remain critically injured.
All right. Tshegofatso, tell us about then, the Joint Operations Committee process. Was that at all followed when this event was organized? Was the medical department alerted to the event that it would be ongoing? Because the South African Weather Services had already issued an alert of severe weather conditions.
Yes. Well, in fact, we must also contextualize the event. It's called the Trupa. This is a cultural event that is held there annually. Normally, it's a very huge event where, the youth will then organize some dances and playing some drums. And even in actual fact, we always have ambulances and other healthcare professionals standby because that's what they do. They would then apply to have officials around. And fortunately, most of our guys were also around and they were able to assist. In fact, if you look at the number, we've been able to dispatch more ambulances than any other time, where we've dispatched more than 10 ambulances to carry at least 150 patients to the local Mathibestad clinic. So yes, indeed, we can confirm that our officials were there even before the actual event happened, just to be part of the actual event because the application was made from their side to have EMS officials to monitor the situation.
Tshegofatso, the South African weather forecast was speaking to Newzroom Afrika earlier, and they've again issued another alert for severe weather conditions. Tell us about what the plans are from your end, in just ensuring that people are safe. And tell us perhaps about the precautionary measures that people can take.
Well, the MEC of the Department has issued a caution to all the residents in the Northwest Province, particularly in flash areas or areas that have identified to be those that will be affected by those thunderstorms. We've seen in Zerastin, Ramotsiri, where we've seen even a hailstorm, and we have also dispatched a team of officials to be on standby. But what we've done, Nompi and the viewers, we are collaborating with our committee members, our traditional healers, our traditional leaders rather, to ensure that they are able to caution our people timelessly. Because we cannot control the movement of the people, but what we can do is to advise the people, especially on outdoors huge events that we've seen in Moretele and other areas, just to also take caution and be able to avoid such big gatherings. But as a department, we can confirm that we have our officials ready to assist in any eventuality. Our facilities, if you look at the Mathibestad Community Health Center, it operates 24 hours. Even as we speak, we have also admitted more patients even this morning just for monitoring, and will then advise by doctors whether they need to be transferred to the Jubilee or the Breast hospitals. Generally, in the Northwest, we can confirm that we have a team disaster management team that is always on standby to assist in situations like this.
Tshegofatso, I was wondering about the post-hospital care that those patients who were treated and discharged at Mathibestad Clinic are receiving. Tell us a little bit about, is there going to be any post-traumatic stress, psychological assistance that is given to them? What kind of aftercare is given to such patients?
Very true, Nompi. The aftercare, it varies because even if you look at the number of community health workers that we've deployed, because those are the ones that are on the ground and that will assist, we've already managed to arrange psychosocial support, especially for the 2 families that have lost their loved ones. And then the team that's on the ground will then advise as to, because some of these patients are still with us in our facility, then would then be advised by our doctors and other health professionals as to when to dispatch or when to eventually activate our psychosocial support to those families that are affected. Remember, those are not only families. Some of them are friends. Some of them are the people that had to travel from as far as Hammanskraal and other areas in and around Moretele. So we have a plan that has been activated to assist everyone that was affected during and even after this event.
In terms of those patients that were transferred to Jubilee Hospital, has this at all impacted the hospital's ability to handle the regular intake of those who are ill and are consulting medical health practitioners there?
Yeah, maybe I should also contextualize this one, because the area that you and I are speaking of is on the border of the Northwest and Gauteng. So the nearest hospital from our side in the Northwest would be Brits. But from their side, which is much nearer, is in Jubilee in Pretoria. So the 13 critically injured were taken to Gauteng in Jubilee Hospital because it's the nearest instead of Brits, which is about 40 to 60 kilometers away from Moretele. But as is, we are hopeful as a department that those that have been admitted will then be receiving the necessary care and then will then be discharged. But we can also confirm that, at least from our side in Mathibestad Community Health Care Center, those that were referred to us or those who were admitted, some of them are now starting to be discharged.
Tshegofatso, thank you very much for your time and all the best for the coming days. That was Northwest Department of Health spokesperson Tshegofatso Mothibedi.